Good afternoon, everyone. We're here in Saudi German Clinics in Jumeirah. It's located right opposite the Jumeirah Beach Resorts in the mall. So today we have with us Dr. Sharmila. She's one of the rare female orthopedic surgeons worldwide and amongst the very few practicing in the GCC and UAE. She's been practicing for 25 years now and has vast experience in orthopedics and arthroscopy surgeries. So today we will be discussing about knee pain, arthroscopy and anything related to orthopedic issues. So to all our viewers, if you have any questions to ask our doctor, you can put it in the comment section below and she would be more than glad to answer them for you. So doctor, today as we're going to be discussing about knee pain and arthroscopy, can you just tell us what is the common causes of knee pain?
The knee pain, generally the causes will be different at different age groups. Okay, so generally we say that older age group, say 60 plus, will be having more of degenerative causes like osteoarthritis. A very young person like adolescent or child will have a different cause of knee pain, which includes injuries with vitamin D deficiency or chondromalacia patelli. It is the middle age group which is which is the most important population part in this region. Okay, because most of the population is working population, so in 30s and 40s. So in them it will be injuries, inflammatory conditions of the knee as well as arthritis. We have seen for last so many years, I'm here since last 15 years in Dubai practicing orthopedics. So what I have noticed is that the world over it is less than 10% that the population is affected with osteoarthritis. Here in GCC it is very high percentage of population, which is almost 30% of people will be afflicted with either knee pain or degenerative arthritis, which is very high. Yes, so the causes will be varying according to the age.
Nice, doctor. So you were talking about the age mainly.
Yeah. And
what is the common age of knee pain in the UAE?
UAE, it is middle age. Okay, so around 30 in their 30s or 40s. People are developing knee pain very early in this region. And I think lifestyle is the main issue here, why they are developing such early onset knee pain.
So what activities or what kind of lifestyle can cause early knee pain?
Yeah, so we come to the risk factors for early knee pain now. Okay, so I think the most important is obesity or weight, okay, which is very simple to understand, that our knees are carrying us everywhere all our life. Okay, so what we put on them, how much weight we put on them, okay, they'll last that much longer. So the less weight we put on or less stress on the knees we put on, they'll be lasting more. So weight control, like at least optimum weight should be maintained for knee pain to have a late onset. Okay, so that is very, very important. Second is people do exercise, but most of the times they end up doing wrong exercises for the knee, and so they end up having knee pain. Okay, the third will be repeated injuries. Okay, so if you're having repeated giving way or loss of balance, or you had repeated clicking sounds coming out of your knee along with pain, okay, all these should not be neglected. At the right time they need to be diagnosed as well as treated. Okay, because repeated injuries will be leading to osteoarthritis, early onset osteoarthritis. And low seating, especially in Arab and Asian population, it is low seating or squatting on the floor or repeated praying positions, which will need to extra stress on the knee, which can have early onset of osteoarthritis and knee pain.
Doctor, you're speaking of osteoarthritis, but what exactly is osteoarthritis?
Yeah, osteoarthritis is a degenerative condition in the knee. Okay, so the knee joint has the bone which is femur, which is upper, and the lower bone. Okay, and the whole thing is covered by articular cartilage, which is a smooth cartilage in between the joints. Plus there are more cartilage structures there which acts like shock up. Basically degeneration of these tissues, degeneration we can say as wear and tear, which leads to inflammation. So it is not only degenerative, it is inflammatory as well, but for a layman to understand, it is just a wear and tear of your joint. Okay.
Yeah,
so that is osteoarthritis.
Thank you, doctor. So is this like permanent? Is it curable?
It's wear and tear. Okay, so whatever wear and tear has happened cannot go back, right? Okay. But we can halt it. We can, with right treatment, with right precautions, we can completely halt it. It doesn't mean, if the doctor tells you that you have osteoarthritis, that doesn't mean end of the world for you. That's the first thing I tell always to the patients.
That's great to have a positive approach.
Yeah, absolutely, absolutely.
Know that you can be cured.
Yeah.
So, doctor, what kind of treatments or diagnosis you do? How do you figure out that a person is suffering from osteoarthritis?
Right. So it is first the thorough clinical examination of the patient. Okay. To know whether there is associated swelling, how much is the range of movement of the knee remaining, is there any deformity which has already happened due to the osteoarthritis. Second, we go on to the investigations. Now, investigations are very important. Even if I can diagnose it clinically, I'm looking at the patient and feeling, palpating, I know what is happening. Okay, I need to document it, one, and second, I need to know the exact amount of degeneration which has happened in the joint. So, third is to rule out other inflammatory causes. So, first, very important is all the blood tests, which should include vitamin D levels as well, because it's very common here to have vitamin D deficiency, and it adds to all the aches and pains in the body. So vitamin D levels and the rest of the blood tests to rule out other inflammatory conditions. Second is plain X-rays, which will just give us the picture about the deformity of the bone which has happened. And third, very important, is MRI of the knee. With which we will be knowing what is the condition of the cartilage and how much is it affected.
Great, doctor. So you were speaking about vitamin D, which is very essential for knee.
It is very essential for basically bone strength.
Oh, that's great. So
yeah.
Here at Saudi German clinics, we have vitamin D.
Yeah, right now promotion is going on, and they're doing it in, I think,
100 dirhams.
Yeah.
So that's great.
Yeah.
Doctor, I also wanted to ask you how to prevent the knee pain, and when does a person suffering from knee pain know? Because most of us, we just take painkillers at home and we hope for the best. So
exactly.
When do I know that I should visit a doctor and get clinical expertise?
If you are having pain which is recurrent even after taking anti-inflammatory or painkiller medicines, you should be seeing a doctor. Okay. I always say that it is better to be a bit over investigated than to neglect something and land up with bigger trouble. Okay, so once you are having recurrent knee pain, which is coming again and again in spite of you taking the anti-inflammatory medicines, you should be seeing the doctor.
Great. So doctor, when you spoke about exercises and exercises gone wrong, which can lead to knee pain or arthritis, so what kind of exercises can lead to mishaps?
So basically what is the right exercise and what is wrong exercise, right? What generally happens with people coming to me is that they are told that they are overweight and you should be reducing weight, and they just jump on to the treadmill, or they just start doing exercises in panic that I need to reduce weight. So obviously they'll be concentrating more on cardio exercises. Now the first thing is, on treadmill, any treadmill, there is no shock up. Okay, so it's not kind to your needs. Okay, so you should be, basically if you're starting walking as an exercise, you should start it on a rubberized track, which are there everywhere in Dubai, I think, but they're outdoors. Okay, so that is very important. So don't jump on to treadmill suddenly when you're overweight and you're not used to exercising. Okay, second is strength training, that you have to have strength in your quadriceps, that is the thigh muscles, the front thigh muscle and the back thigh muscle, both. Okay, so you should, I always recommend to get a trainer and start with the trainer to train for the strength in the thigh, and then you can go on to the cardio. Okay, so weight reduction is not an emergency. Okay, that you're told to reduce weight, it doesn't mean that within 2 weeks you have to reduce all that has piled up for 10 years, right? Yeah, so gradual weight reduction with right kind of exercises. Very highly recommended exercises for the knee is swimming. Okay, so those who know swimming, they just should be doing swimming. It will work miraculously on knee pain. Second, if you don't know swimming like me, okay, you can still go into the pool and hold on to the bar, do cycling movements underwater, and you can simply walk in across the water in the swimming pool. These two also work very, very well. If you're doing heavily if you are heavily into yoga, then with knee pain you should be checking with the doctor what postures you can do and what postures you should avoid completely. Again, another very important thing, that most of the people who start these exercises suddenly, they'll be heavily into squatting also. So again, squatting is going to put more pressure on the knee and is not good when you are having knee pain already. So basically either consult your doctor or have a trainer who has a good knowledge of knee pain and anatomy, and then go ahead.
Thank you, doctor. It was very informative. You gave us tips on how to lose weight along with not to have knee issues and knee pains and problems.
Yeah.
So doctor, I just want to check with you, does footwear have any impact on knee or the bones?
Yes, very much. You are touching all the sensitive topics, okay, especially for the female patients in this region. Our leg is like this and foot is like this. Okay,
yes.
So this is the nature which nature has given us this
Posture,
structure,
yeah.
right? And so we are supposed to walk like this. Now just imagine if you are like this on the foot, okay, and your heel is here, which is 6 inches. What are you doing with your foot? Okay, I mean the whole pressure is coming on the forefoot, and it just gives you painful foot, painful heel. Your whole axis of the body changes, the center of gravity changes. So that's very important cause of knee pain and low back pain as well. Now low back pain is a completely different long chapter, I should say, but yes, it's very important, and I generally recommend to wear very soft cushioned good sneakers.
That's nice, doctor, but I think with most of us women,
yes,
beauty comes with a little bit of pain.
But if it becomes permanent structural change, it is a problem.
Right.
Okay, so like I always say that, okay, I mean, I understand that you have to party, but your bones don't understand that you have to party.
Get it, doctor. So could this lead to any other problems? Could like your wrong kind of footwear lead to varicose veins or anything of that sort?
See, it is like pressure on the forefoot. Okay, so it can lead to a tight forefoot, a tight heel can also lead to a hallux valgus. Then there are hammer toes, okay, which is toe deformity. Then there is high arch which is happening here, so it leads to painful heel and plantar fasciitis. There is tight tendoachilles, okay, so the tendon which is behind gets contracted, so there is very tight calf also. It leads to knee pain, it leads to back pain because of imbalance of the whole system. So it just you're just throwing it off balance actually.
Right. So just avoid the heels.
Yeah, avoid as much as possible. Don't wear it for very long time. For short time, yes, of course you can.
Great, doctor. So doctor, when you speak about knee pain and osteoarthritis, do you always do surgeries, or is it curable through medications?
No. Surgery is the last option. Absolutely last option. Okay. So if somebody has osteoarthritis, the treatment options are many. Generally, we start with anti-inflammatory medicines, cartilage supplements, some physiotherapy, activity modification, exercise advices, and weight reduction, which is very, very important. Now, if someone is not responding to all this, okay, the second line of treatment which will come is injections inside the knee, which are viscose supplements, which are hyaluronic, which is a fluid inside the knee, which gets depleted when there is osteoarthritis. So it's a lubricant inside the knee, and it will just make the knee a bit smoother from inside. Okay, the second one, which is latest, most logical and very effective, is stem cell therapy, which is there are again different types of stem cell therapies. The starting one is a PRP, and then we go on to BMAC and more complex stem cell therapies. Okay, so PRP is when we just extract the blood, like you give it to for blood checkup. Okay, so we'll take out blood from your vein and we treat it, or we separate the growth factors from it, and those growth factors are injected in your knee. So there is nothing external which goes into your knee. It's from your own body. The growth factors are being put in the knee, inside the knee. So they will start the healing process inside the knee, and there are few stem cells in them which will be again activating the cartilage cells to regenerate. So basically these are all parts of regenerative therapy. The next step will be bone marrow stem cell therapy, in which we just take by injection bone marrow aspirate, again separate the growth factors and the stem cell and put it in the knee. This is worldwide. It's gaining a lot of popularity. We are seeing lot of good results with it, and many times we've seen that the cartilage thinning is also reversed back. Okay, so it's almost in many cases reversing the whole degenerative process back. So it's really a breakthrough treatment right now.
Nice, doctor. So all of these are all the latest technologies to treat, or are they more advanced?
No, they all are being done here and are available in Saudi German clinic as well as hospital, and we are all doing it. I'm doing it for sure.
That's great, doctor.
Yeah.
So when you do these treatments, what is the downtime?
Yes, that's a very good question. Generally, if I give the BMAC or the PRP therapy, most of the patients will be needing 3 injections, which are spaced apart at 10 days time. Okay, so generally treatment lasts for a month. Okay, patient is not bedridden at all. It's an OPD procedure. Patient can come, get the injection done and go home. First 24 to 48 hours he can have a bit of inflammation, so he can take some pain relievers, and that's it. Okay, but yeah, 3 injections for 10 days.
So doctor, when you speak about PRP injections, how many courses or sessions should a patient take to be completely cured?
Complete cure is a very dicey phrase to use. Okay, but yes, with 3 to 4 injections over a period of 1 month, generally patients most of the times get 95 to 100% of pain relief with PRP, and it's a natural process. Okay, so it is inducing healing in your joint, so it will take time to whole of the remodeling to happen. So we give it next 6 months time to observe the patient and see him after 6 months to assess whether he needs the next one or no. In contrast, before, like say 10 years back, lot of steroid injections were being given in the knee for the painful knees, and then it was proven that that is causing more degeneration rather than it was a short term pain relief but long term degeneration. So that all will be avoided with stem cell therapies.
That's nice, doctor. So do you always like you said, surgery is the last option.
Right.
So I just wanted to know, what are the other things you do to avoid knee replacement surgery?
Yeah, so as I said initially, with physiotherapy and stuff, okay, followed by stem cells therapy or PRP injections or hyaluronic injections, which are the lubricant injections.
So physiotherapy goes hand in hand with the PRP?
No. Generally the first line of treatment is physiotherapy, and if it is not working, then only we'll go to the next step, right? Okay. And after that, if that is not working, and if we feel that the chondral defect, that is the cartilage defects, are big enough, then we go in for arthroscopic surgeries, in which we just do an endoscopic surgery where there is no no cutting open of the joint as such. It's again 1-day procedure where the patient is up and about in 24 to 48 hours. And yeah, so lots of treatment can be done with the knee arthroscopies as well. Stem cell injections can be repeated many times, okay, till the time we are convinced or the patient is convinced and patient demands that, okay, no, replace my knee, now I can't take it anymore. That's the time when you should be advising really the
So even
replacement.
after surgery, how long would it take for them to get back to the normal walk of life?
The replacement surgeries,
Yes,
they should be back to near normal within a month's time.
Okay,
with all the physiotherapy
That's
support
great.
and everything.
So doctor, from what I understand about knee pain and all of that, it's related to your bones being weak.
Right.
Right. So do you have like a diet plan or anything that we could include in our diet which would strengthen our bones?
We have a nutritionist in-house in Saudi German clinics as well as hospital, where we can actually give patient what is needed, okay, because I would advise them to go through the blood tests to actually see for the deficiencies, look for the deficiencies, but otherwise having a very good balanced diet with lot of vegetables and fruits as always, okay, it's very, very good. Don't avoid milk products. I see a lot of patients here in GCC and UAE avoiding milk products altogether. If you don't like milk, you can go for hundreds of cheese which are available, which are again very high in calcium, okay, or yogurts, or there are so many options available. So you should not be avoiding that, okay. If you are a non-vegetarian eater, then you should be going for fish also should be included in your diet. Plus vitamin D, I cannot give more importance to vitamin D. Early morning, at least half an hour, everybody should expose themselves to direct sunlight, which should fall on your hands and legs, skin directly without any sunscreen or a curtain or glass in between. Basically full hands and half legs, this much surface area needs to be exposed to sun, okay. So early morning, you can't go out here after I think 8 o'clock also out in the sun. So at least early morning you should be doing this for half an hour.
That's great, doctor. Thankfully, we have no deficiency for sunlight. Thank God.
Absolutely, and it's free.
And it's free. Most important.
Yeah.
So once again, thank you all of you who have watched us live today on Facebook and on Instagram. We had with us Dr. Sharmila. She's an orthopedic, amazing consultant surgeon. So we're here at Saudi German Clinics. It's in the mall, situated right opposite the Jumeirah Beach Resorts. So if you want to book an appointment with Dr. Sharmila, it's 800-2211. Thank you once again for watching us.
Thank you so much.